Welcome back, everyone. And joining us here today on our program, we have a guest, Dr. Mohamed ElSafe, who is the consultant of internal medicine and blood clotting and blood vessels. So thank you for joining us here on the program today, Dr. ElSafe.
Yes.
Thank you for joining us.
Yeah, thank you for inviting me.
You're welcome. And you're going to be talking to us today, I believe, about the International Quit Smoking Day, aren't you?
Yes.
Yes.
Actually, I mean, the purpose of this public awareness day to raise the awareness of smoking-related health hazards, and also to shed the light and to specific, message about tobacco control, and also to promote adherence for the WHO framework convention of tobacco control. I mean, so it was smoking, previously linked only to cigarette. Our, aim in this, public awareness day, that too, smoking is also related to other tobacco products, and also passive or second-hand smoking and third-hand smoke, all considered, smoking.
Indeed. Now, Dr. Saif, how do you think we rate in comparison with the West in terms of our awareness about the dire consequences of smoking on human health?
Actually, I think we are lagging behind, and we are one of the top countries, consuming tobacco in the world. And actually, the prevalence of smoking, tobacco product is 45%, among males and 5% among females. I think this figure is underestimated, and if we include other, smoking tobacco product like Shisha Masel, maybe the figure might jump to about 60%. And I think this is our message to convey to the people. And we are also, I mean, in terms of economic, expense for smoking, about, the figure which came recently, about 20 millions, per year.
And sorry, do you think that there's so what more should we do to raise the awareness of the dangers of smoking?
Yeah, I think one of the methods we have done, I mean, to arrange for International Tobacco Day, where you directly, I mean, interact with, the public, patients, and it's one-to-one, I mean, teaching method where you show to the patient health hazards of smoking by, written materials like pamphlet, I mean, brochure, booklet. Also, we have shown to the patient, I mean, real, smoker lung compared to non-smoker lung, borrowed from anatomy lab, and also we've shown some PowerPoint presentation and videos. So we have to target, smoking from all directions.
Right. So, Dr. ElSafe, alongside the awareness campaign, there was also an awareness exhibition happening. Now, what were the main things which were happening in the awareness exhibition?
Yeah, actually, this, I mean, exhibition, I mean, was participated by more than 10 departments, including clinical nutrition, where they were teaching a patient about after quitting smoking, they might gain weight. So what are strategies to overcome this weight gain? And also dental department, where they're teaching patient about the risk of, chewing tobacco or smoking tobacco, oral cancer, and poor oral hygiene, and respiratory therapy, where they measuring the vital capacity of the lung, just to show to the smoker that this is, I mean, a way to convince a smoker your lung is, the function of your lung is declining. And also we included exhibit by a medical student. It was really superb. This is maybe the first exhibit that we have brought all tobacco methods or tobacco products used in Saudi Arabia across the north, south, and east region, and each one we link it to how equivalent to cigarette smoking. And also we have arranged for art exhibit where there, two painters participated by about 13 paintings, all demonstrating smoking hazards. And the response by the audience or by the public was tremendous. And also there was exhibit or both smokers, if they drop their pack of smoke, they will be replaced with a pack, but content of the pack is sugar-free, gum, miswak, and also lighter, which looks like a pen. It was a very nice idea. Many smokers, they drop their, packs. Okay.
A pen which looks like a lighter, or a lighter that looks like a pen?
Okay.
Well, very, very interesting. But Dr. ElSafe, I would like because I know that a lot of people are watching us right now who are smokers, including the men and the women. So I would ask you to tell us a little bit, to educate us, myself, Camille, and as well as our viewers, about the different forms of smoking. And I would ask you to pick one of the ones which is the most dangerous. Cigarette, cigar, pipe, shisha. Which is the worst?
Okay. Shisha, there are two types. There are Jirak,
Yeah, Jirak, the
and there is the other
one.
Ma'asel. Jirak Shisha is the worst, okay? Is the most
because it's
harmful.
pure tobacco.
Sorry, what is the difference? I don't know.
Camille, Jirak is the kind of shisha which the people used to do in Saudi Arabia. That was a long time ago. It's still a practice, but in the new generation, it's more about the flavored hubbly-bubbly or shisha or Ma'asel, whatever they call it.
Yeah, so the different Jirak, it's a mixture of, cooked tobacco, pulpy fruit, and molasses, okay? It's burnt sugar. So it has really offensive smell and rotten, fruits.
Okay.
This is, each 15-minute smoke, okay, equivalent for one cigarette, and can generate, higher carbon monoxide level in the blood. It was confirmed in a study conducted in King Abdulaziz University in Jeddah, and they compared smoker of Jirak versus cigarette smoker, and they found higher level of carbon monoxide, which is associated with cardiovascular risk like heart attack and atherosclerosis.
So Jirak is the worst of them all. Now, how do the shisha, the cigar, and the cigarette and pipe rate?
Okay, so rating is this is common quoting. If you they will say one session of shisha smoke is equivalent to one pack. But we reviewed the most recent literature done in the last 2 years and showed it is not accurate. It is even higher than one pack. So the nicotine content equivalent to one pack of cigarette, but other toxins like carbon monoxide, which is generated by charcoal, because burning charcoal can increase level of carbon monoxide. And also they are saying one session of Ma'asel, which is the nice, sweet odor, okay? It is equivalent to 10 cigarettes, okay, one session. But remember, our people, they don't, take one session, two, 3, 4 sessions consecutively, so it might be more equivalent than, I will say, 2 pack.
But good that at least you corrected the stereotype that one shisha is equivalent to 60 cigarettes, because a lot of people say one is equivalent to 60 cigarettes. So good that you said it's equivalent to 10.
Yes.
And on this note, Dr. ElSafe, stay with us. We still have lots of things to ask about smoking and how important it is for us to be living in smoke-free environments. But for the moment, let's go on towards our theme report, which is all about the Quit Smoking Day, after which we are going to return back to resume our live discussion with Dr. Mohamed ElSafe here from the studios of Good Morning KSA.
I'm the head of organizing committee of the World No Tobacco Day 2011, which was held in King Fahd Medical City and led by Department of Medicine with collaboration with other departments, in addition to other participating groups from outside the hospital, from Minister of Health, like anti-smoking program, and also a group of superb medical students who are participating in our group.
Addiction is the hardest addiction, and King Fahd Medical City is a leader into health care of the population, and we initiated this day in order to create an awareness among people to know about the harm effect of smoking on the health. Smoke addiction is very hard. Why it's very hard? Because it goes into our biological buildup of our brain. We don't want to explain more of that, but we will say women, if they are addict to smoking, it's very hard for them to stop than men. This is why we really focus on women, and mainly pregnant women. They should not smoke by any means. Needless to say about men, and it can affect the other people around you. It's not just affect you. The smoking can affect the other people. We pollute the climate around us. Therefore, we are initiating this day so we can make people aware about it and the harm, and it's just one of those things that we need really to pay attention to it.
We try to focus that smoking is not limited to cigarette smoking. It is also smoking other products of tobacco like shisha, masel, jarak, chewing tobacco, cigar. That's why we have a booth here that exhibiting all these smoking tools and telling the hazard of each one. And also we have this year that a booth that all smoker, once they get rid from their smoking bucket, they will be gifted with a pack full of gums, swag, and some the bin, which looks like lighter. Okay. Also, we are trying to check some blood test for smoker, for checking level profile, glucose, because this is all looking at the patient as comprehensive cardiovascular care. I think we'll try to be unique this year compared to the last year.
All of them you have to consult with your physicians to really get information on the best selection for yourself and which one to use for your quitting. Also, in our booth, we're discussing with the patients different ways of quitting and the benefits of quitting and drug interactions that may be caused from smoking. So, for example, you may be smoking and and you're taking a certain medication. This medication may lead to an interaction with your smoking habits. Okay, so your drugs may be affected by your smoking. And we also addressed benefits from quitting, starting from the time that you quit the cigarettes, the time you stop smoking to after 15 years of stop smoking. So it's a continuous benefit. It starts within 15 minutes from quitting smoking by having a better heart rate and having to breathe better, and it moves down after 15 years by reducing your cancer and reducing your risks of cardiac and cancer risk. Yeah.
We are trying this awareness day to educate people about smoking effects on oral health. So first thing, it's affect by causing staining, calculus, caries, smokers, high risk for caries, for periodontal disease, that's the disease affecting the supporting tissue, that affecting the teeth. The biggest thing is the oral cancer. Smoking affect tongue cancer, nasopharyngeal carcinoma, and many types of cancers. So people have to know about the stage of the disease of oral cancers and what's the sign and symptom, early sign and symptoms, and what's the stage of the treatment of cancer. So maybe they are trying to quit by knowing this stage. So we have a lot of brochures and basic information about toothbrushing, dental floss, and oral cancers, and smoking effect on oral health.
Welcome back, everyone. And continuing with our discussion in the studio, with us here is Dr. Mohamed ElSafe, who is the consultant of internal medicine. And he is talking with us about the very serious topic of quitting smoking and the awareness program that is being held, the International Quit Smoking Day. So Dr. ElSafe, welcome back once again. And we were talking before the break, before the report. So can you please tell us about some of the new methods that will help people to quit smoking? I believe there's a new drug out. Is it?
Chambex.
Could you tell us a bit about that?
Yeah, I think a very important concept, you know, that smoking is a combination of addiction and smoking routine. So to break, you know, so you have to, first of all, you have to have strong determination to quit smoking. If you are not willing to quit smoking, whatever medication you use, it will not, you know, you will not be able to quit smoking. So, I mean, in terms of after deciding to quit smoking, then we use medications. The classic medications are nicotine replacement therapy in form of gum, lozenges, patch, inhalers, spray, all okay. And the best to use, you know, combination like patch in addition to nicotine gum, okay, or inhaler to break, you know, the craving in between cigarette. But recently, for the past few years, there's a new drug. It's called Chambex. It is oral medication, so it acts similar to nicotine, you know. So it is, it can mimic nicotine in the blood, so will decrease your urge, you know, to smoke. And the course is for 3 months, and we are starting to use it in our hospital, King Fahd Medical City. I have experience using this medication in Canada, and it was very successful medication. I think it's future direction for quitting smoking.
Right, Dr. ElSafe. And Dr. ElSafe, some of the people, for instance, like, you know, cigarettes vary. So some cigarettes you would see as, let's say, 7 mg tar, 7 mg nicotine, and 7 mg or 0.5 mg carbon monoxide. And then there are cigarettes that you see 0.1, like 1 mg nicotine, 1 mg, let's say, everything else, like, you know, it's 111. These cigarettes are very popular, especially here in Saudi Arabia. So now, how do you think these cigarettes are? I mean, do you think that they are, in comparison with the other cigarettes, less harmless, like less harmful? For instance, let's say if I take one cigarette, which is 7 mg nicotine, 7 mg carbon monoxide. In comparison with that, if I leave this one cigarette of having one cigarette habit, to moving on towards having 7 cigarettes, 1 mg carbon monoxide and 1 mg nicotine. Could I take 7 cigarettes and those would be equivalent to 1 according to the numbers, or health-wise is it any different?
There is no evidence, you know, in the literature that light cigarettes are less harmful than, regular cigarette. This is what's called a marketing scam. And because there is a Canadian study that compared 7 types of light cigarette, and they found content of nicotine is similar to regular cigarette, and also the risk of cardiovascular risk and cancer is similar in light cigarette smoker and regular smoker. But this is we don't have our local study about to compare our light cigarette with the regular cigarette. I think this is maybe interesting research area.
Indeed.
And Dr. ElSafe, just one more question about the Champex, that drug. So if I was a smoker and I was looking to quit smoking, say, and I had, say, tried the patches and I had tried the gum or the various things, and I wanted to try that drug, could I go to my doctor and say, doctor, could I be put on this medication? But as you say, you have to have the willpower and the decision within you that you want to quit smoking before you can actually do it. But what is the success rate as well of that drug? Percentages and stuff like this?
So as you have said, after a medication, strong determination, and you have to counsel your physician. This is very important, okay? This medication should be prescribed by physician, okay? And you have to have regular follow-up. The success rate, they compared this medication with the standard, of care medication is nicotine, replacement therapy, and they found that it's twice the efficacy than, nicotine replacement therapy. So that's the way. They didn't compare it with people who are not taking any medication. So with nicotine, it is more effective, like 50%, more effective.
Indeed. And also, Dr. Safe, I believe one good thing for the people to do when they are trying to quit smoking is to, for some time at least, until they have really grown immune to avoiding smoke, to avoid smokers' company as well, because a lot of times you might be resisting your constant urge. Of course, if you would try to make these big changes into your life, these are life reforming changes, it would be very difficult for you to be in the company of smokers where they're blowing their smoke into your face. And not only you're being a passive smoker, you're inhaling second-hand smoke, which is usually said to be more dangerous than first-hand smoke. And as well as you have to stay determined and you have to modify your lifestyle. That means your eating pattern, your sleeping pattern, and as well as your consumption of fluids and water as well, because a lot of people have the complaint of having to put on weight once they quit. And for a lot of people who have a good success ratio, eventually give up to the habit of smoking again because they do not know what to do with their hands. So I believe that for people like that, Dr. ElSafe, this particular gadget is going to be very good and handy. These things are called green smoke, and actually you could find them anywhere. You could Google them online, and this looks like a slim cigarette, but of course you see that it is green, and once you try to blow onto it, you see like a green light over here. So that means that this is safe for human consumption. So try to opt for different kind of ways and means that it would work out for you. Perhaps carry like a handful of nuts with you that you continue munching on while you're trying to resist your urge to smoke. And well, we wish you all the very best of health.
Sorry, I believe, Sami, you can even use those on the airplane.
Yeah, exactly. You could be smoking anywhere that you want with a green smoke like that. So certainly that's the brighter side as well. And well, with this we wish you all the very best when it comes to smoke cessation from your lives. Remember, you're not only doing yourself and your health a favor, but you're doing your family a favor and your community a favor by keeping your surroundings smoke-free. And with this, Dr. Mohamed ElSafe, we'd like to thank you very, very much for joining us in today's edition of the program. And we really do hope that you would come back to join us again in the program in order to brush up people's awareness levels.
Yes, thank you. I think this is the theme of our, World No Tobacco Day. We are not targeting smoker and his family, They're affected by second and third hand smoke. That's the theme of our, World No Tobacco Day. Thank you very much.
Indeed. We wish you all the best. We need more awareness campaigns like this. And well, so that was all for our smoke cessation segment. This was dedicated to the Quit Smoking Day and keeping your surroundings clean, healthy, and smoke-free. But on this note, we are going to be moving on to our next report, which is about Child's World. And well, of course, as every Sunday, we have Child's World segment in the program. Today, we are taking a look at one of the most important basics, one of the most important things you need to instill in your child from a very early age. Stay tuned. Let's go on towards our Child's World.